I saw at one conference that really bothered me. Someone was telling a story. He was an interventional cardiologist, and he was really interested in preventative medicine, preventing heart disease and atherosclerosis and heart attacks and all these sorts of things. And he was talking to a colleague of his about his interest in this. And his colleague was an interventional cardiologist as well in the UK. And he said, I don't want to prevent heart disease. That's what pays my bills. I don't want there to be less heart attacks. I want there to be more heart attacks so I can do more stents, so I can take more people to a cath lab, all these sorts of things. I mean, that guy should be locked up. That guy should, be, probably, you know, given a blindfold and a cigarette and put in front of a wall. I mean, that's like, those are the type of things we hung people for Nuremberg trials. I mean, you don't do that. You want more heart disease, you want more suffering, it's just so you can make money. Like, that's wild. But if you can change the incentives, so you're not making 15 grand putting in stents in somebody, you're making not that much, but you're making a decent amount of money educating people so they never have to have stents in the first place. I think that might be the way. Well, I think that would help people anyway get better outcomes.
I agree. It harkens back to the origin of physicians and
Mhm.
the original origin of physicians, because in the United States, I mean, physicians were really, they were the class of people that were either doing butchering or they were doing hair cutting. And that's the origin of physicians and surgeons. So that's the fundamental basis. And then there was a large group of people that were mostly women that were sorceresses or witches.
Mhm.
And so that's the origin of medicine, but it didn't get corporatized. It didn't become like medical school with corporatization until people decided that they wanted to sell drugs and they needed high price salesmen for these drugs. And so that's the origin of why we have medical school, because it was a way to indoctrinate a sales crew
Hmm.
into it and keep a separation between you and the sales crew. And the sales crew makes their money, but they sell your product and they just don't realize it that they're selling your product. And so it's the origin of pharmaceutical sales is a problem. And almost everything that we do in medicine is driven by these large agencies that are trying to figure out how to sell more drug. Because when you make a drug, it doesn't, you do some research, you make the drug. And at that point, like for example, Ozempic probably costs $5 to make a dose of Ozempic, but they sell it for $800 to $1,200 a month.
Jesus.
But it costs $5.
Mhm.
Insulin, it costs almost nothing to make, but they sell it for $1,000 a month. That delta is the incentive for those companies to do that, but they can't do it on their own. So they have the physicians do it by manipulating the physicians into saying, "Oh, this is what you need, patient. So here, take this medication." So we end up in bed with the pharmaceutical industry if we're not careful, and and that's pretty classic. That's how it works. Almost all new devices, you end up in bed with the device manufacturer, and the margin is really on the side of the manufacturer of the medication or whatever. In the United States, we have these things called PBMs, which are wholesalers for medications, and they make a ton of money. The hospitals make money because there's programs where they can buy pharmaceuticals at wholesale and then they can sell them at retail and they get to keep the difference, but they got a subsidy to buy them at wholesale. So a lot of the medical system in the United States is driven by medication, and it's the sale of that medication. And it just so happens that physicians are, one of the derivatives is that they were high price salespeople,
Mhm.
and I know that's very pejorative, and I know that people take that as offensive, but that's the origin. And so to separate yourself from that, you have to step away. You
Mhm.
cannot accept funding from drug companies. You
Mhm.
really have to. Once you get away from that, then it clears your thoughts and you ask yourself, okay, what's the best thing for my patient? Not what's the best thing that this drug company told me to give them, but what's the best thing for the patient? Because I mean, medications are life saving, and we need them. But just because you reformulated it slightly and change the milligram dosage slightly and then put it under a new patent doesn't mean that you should charge an extra couple $1,000s for it. And the reality is that if you're trying to do health and you as opposed to unhealth thrives on misery. And it's like the creature that just lives on the misery of human beings. And we can get away from that if we make human beings healthy. But then that means that a big chunk of our healthcare expenditures will disappear, and it'll radically shift the power in the structure, in our governmental influence and things of that nature. So it's a tough thing. It's a tough road to hoe. But at the end of the day, if you want to really help your fellow human being, that's where we should be as physicians. We should be trying to make that radical departure difference that says, hey, my patients don't need this, or I can figure this out without this. Not to say that there isn't like amazing stuff that we can do with medication and techniques and procedures, and we need to do those things, but there's other things we can do as well. And then we wouldn't have, if we incorporated lifestyle coaching and health coaching, it would take more resources in terms of people and other things, but it would potentially stop a lot of the complications, because these devices and medications also have complication risks, and those complications build up. At least 5% of people are misdiagnosed completely, and then probably one of the number one causes of death in the United States is iatrogenic. We caused it our own selves. We caused the problem that killed the patient, and we didn't do it on purpose, but it's a side effect. And so those are the things that we need to kind of be aware of.
Hey guys, just want to take a second to thank our sponsor, Carnivore Bar. I don't promote many products because honestly, all you need to be healthy is to just eat meat. For those times that you're out hiking, road tripping, or stuck at work and you want a nutritious snack that is just meat, fat, and salt if you want it, the Carnivore Bar is a great option. So I like this product not because it's just pure meat, but also because I want the carnivore market to thrive as well. And the more we support meat-only products, the more meat-only products there will be available in the mainstream. So if this sounds like something you'd like to get behind, check it out using my discount code Anthony to get 10% off, which also applies to subscriptions, giving you 25% off total. All right, thanks guys. Yeah, yeah, I'd say both my grandparents were sort of let down by the medical establishment, probably would have fallen under iatrogenic cause of death, unfortunately. They were in their 90s, but they didn't need to, it didn't need to happen the way it did, and there are a lot of very well-meaning people that are just in a system that funnels things in a very specific way, unfortunately. And the patient doesn't always get the right end of it. Yeah, it's interesting, how expensive insulin is. That I was looking at, Gary Taubes, who wrote a book called the origins of diabetes and treatment and everything like that. And he spoke about how when they discovered insulin and its use obviously in diabetes and type 1 diabetics in particular, they thought it was, I mean, these guys, I'm pretty sure they won the Nobel Prize for this. And they thought it was such an important thing for the world that they didn't even keep the patent. They sold the patent to the public for $1. Just, it was like, no, this has to be everywhere. No one should be, capitalizing on this. It's probably unfortunate they did that. They probably should have kept the patent and then sold it for a reasonable price, because then people got their hands on it, and then they manufactured and sold it for for exorbitant amounts of money. And obviously it's 100 years down the line now. I mean, that was 1921 when they came up with insulin, and now it's they're coming up with all the new different kinds of insulins and things like that, so they can just keep charging more and more and more. And then there's other sorts of issues too. I mean, there was all that weird problems with the EpiPens, where they sort of boxed out their competition, and then all of a sudden EpiPen was the only one on the market, and then all of a sudden, boom, it was $400 a pen. And I was like, what are you doing? I mean, you're talking about like kids with a peanut allergy, they're gonna die, and it's just like 400, let's go. It's pretty ghoulish to do something like that when you're talking about saving someone's life. I remember a friend of mine He was he was from Ireland, and he was playing a game in the U.S. somewhere. Don't remember where, East Coast somewhere, and he had travel insurance. But then he like broke his arms, sort of distal radius, and so it was real simple. Was in there for a day case just to just to do an open reduction and fixation, and just put a little plate in it. And so it was really easy. It was just a day case, didn't even stay overnight. And he got the bill and it was like 50 grand, you know? And he's looking through this like, what in God's name is this? Or maybe it was even more than that. Um, and this was, 15, 20 years ago. And he looked at the itemized breakdown of it and he found he said that he was in pain in recovery, and they gave him two Tylenol, and they charged him $600 for those two Tylenol. It was
Yeah.
just wild, just wild that they can do that as well. And I guess when you have travel insurance, they'll sort of pay whatever. But I mean, it was just taking advantage of that was just shocking to me.
Well, if you look at I'll give you an example. It's akin to this. And I looked at, I work with my orthopedic colleagues all the time. In the United States, if you get a total hip or total knee replacement, what do you ballpark is the surgical fee for a total hip or total knee in the US?
Oh, I would say $8 to $1,200, maybe.
So yeah, the surgical fee for a total hip is 1375. For a total knee is 1430. That's the surgery fee
Yeah,
in a hospital.
yeah,
But what's the
oh,
fee that they're charged Medicare?
yeah,
It's between 65,000 and
yeah,
$95,000.
yeah,
The bulk of that money goes to the facility.
yeah.
About $20,000 of it, between 8 to 20,000 would go for the implant. But the surgeon is making 1375
Hmm.
to 1470, whatever it is, and they take care of the patient for the next 90 days. And so if the patient has a complication in the next 90 days that's associated with a total hip or total knee, the surgeon's going to have to take care of it gratis.
Hmm.
And that tells you where the incentive is, because the surgeon barely making it because it takes them 40 minutes to do that procedure,
Hmm.
and they've got to still pay their office, they got to pay everything, and the surgeon's not making much money. Who's
Hmm.
making the money is the hospital, it's the
Hmm.
facilities, and it's the pharmaceutical industry. It's not. So the average income, inflation adjusted, for physicians has gone down in the United States by 50% over the last 10 years.
Wow.
Inflation adjusted income is down 50%, whereas the cost of healthcare in the United States has gone up by 80% inflation adjusted in the last 10 years. So what's going on here? Why is the physician income down 50% inflation adjusted, but the cost has gone up 80% inflation
Hmm.
adjusted? The difference is that per physician, we now have 10 administrators in the United States who can't practice medicine but work in healthcare. So each physician is pulling the donkey cart for 10 administrators, and they need that physician to work a lot harder so that they can maintain their salaries. There's been a 3,800% growth in administrators in the United States. That's ridiculous. And so we've gotten so far away from practicing medicine that we're basically we've become the slave class almost. And I
Hmm.
hate to say it that way, but that's what it is. If we stopped doing what we're doing, there'd be a lot of administrators that would be really pissed off,
Hmm.
uh, because they need us. But at the same point, we need to help our patients, and we need to be able to spend the time to do it, um, and to do it correctly. And so, and we've just migrated from one catastrophe into another. For example, we have this amazing drug, Ozempic and Mounjaro. These are GLPs, and we use them to a small degree, but within the context of their what they're used for. So they certainly will help you lose weight because they'll give you gastroparesis. They stop your stomach from emptying. But there's something more important, and that is that they cause your brain to be anhedonic. They cause you to no longer seek that pleasure of the food, which reverses that hedonic cycling. And when you do that, it has a side effect too, which is if you're an alcoholic, you stop drinking. And so if you're a serious alcoholic and I put you on a GLP, you might end up seizing
Mhm.
because you acutely stop drinking because you no longer have a desire. And that's happened to me a couple of times. That's
Oh.
issue one. Issue two, though, is because you get gastroparesis, you can't empty your stomach, so you're not likely to eat, and you can't break down protein. And when you can't do that, you start to get sarcopenic wasting first. And the sarcopenic wasting precedes the weight loss. And that sarcopenic wasting never comes back. So
Mhm.
even when you get off the GLP, once you've gotten to your weight that you think that you should be at, you've gotten there in a way that you've lost your muscle mass, and that muscle mass doesn't come back. You get
Mhm.
off the GLP, all of a sudden you gain the weight, but it's not muscle, and you're at a higher risk of having problems because you're not able to produce the myokines that you need, which are actually anti-inflammatory, and you end up with more white adipose tissue producing more leptin, which has all of the cytokine problems and all the inflammatory issues. So
Mhm.
you're not getting the benefit that we'd want. And what we did was we traded insulin for Ozempic, and they both cost $1,200 a month. So the companies didn't lose any money, but we made the patients sicker over time. And I think that that's going to be our next big thing is we're
Mhm.
going to see patients that we've put onto Ozempic. They've gotten a lot sicker, and now they're skinny fat, and they're going to be even worse than they were, and they're going to be a higher risk of fall and a higher risk of sarcopenic loss.
Yeah, definitely. Hey everyone, really happy to announce a new sponsor for the show and for everybody down in Australia. It's Stockman Steaks, who are delivering high quality grass-fed and finished pasture-raised beef and other meats, flash frozen and vacuum sealed to your door, something that I've been enjoying a lot of myself recently as well. They also have a great range of specialty items such as high-fat keto mince and carnivore beef and organs mince with liver, kidneys, and beef heart as well. So use code Chaffee today for a free order of beef mince or another specialty gift along with your order at stockmansteaks.com.au, and I'll see you over there. Thanks, guys. Um, yeah, I actually I've heard this for years. I'm sure you have as well. That the reason that healthcare is out of control and the cost of healthcare is out of control is because doctors just get paid too much, and they're just all rolling it and things like that. And and that always pissed me off because I actually read an economic report that showed that if you didn't pay doctors a single cent, that it would not appreciably lower the cost of healthcare to the people. It would not change anything. We're basic, like you said. People go, they're just coming to see the doctor, and you're supporting the entire establishment. It's a big establishment. It's a big hospital. These things are like little cities, and you're going to see the doctors. Those are the minority of the people that work there, and they get paid a minority of the fees, and have sort of turned doctors into sort of hourly workers. They're just a wheel in a machine, cog in a machine, and they're just there to churn out office visits and procedures just to generate revenue for the hospital. But they don't see much of that. They're just a sort of an hourly employee or bill for procedure sort of employee. Whereas it used to be the doctors, would own the practice, would own the hospital, and now you have these big HMOs and massive corporations that own everything and just hire doctors, and then they just feed off them. A friend of mine who's a lawyer sort of equated this to indentured servitude. They've sort of, and school loans as well. You get these massive school loans, like hundreds of thousands of dollars, and you're paying those off for 20, 25 years now, and you're paying back far more than you borrowed, and the interest rates, what, 8.5% or something like that, I think is on my student loans anyway. And so it's a massive ROI for these people. And I think when I graduated medical school, I had already racked up another $100,000 in interest. It was like, okay, it's like already at the point of absurdity at this point. And that then they have you working for them sort of for the rest of your life, and then you're in this institution that you're basically just churning out money. And like you said, you sort of you're in this indentured servitude. We brought you here, we let you be a doctor, but now you work for us for the rest of your life. And it's sort of this deal with the devil that they've sort of snuck in on us, because that didn't used to be the way. Doctors used to do very well, and because they had slice of the pie of the profits, and they would have part ownership in the practice or the hospital or something like that. And like my great grandfather, he was went to Columbia. He was still to date the youngest graduate from Columbia Medical School. He was like 20 years old. Couldn't even practice until he was 21. So we had to just go home and hang out like the 18 Doogie Howser 1800s, and just and then go back to residency after that at Bellevue Hospital. But ended up in Southern California, and he was like the 13th medical license that California ever gave out, and he helped found Redlands Hospital. And so, he was part owner in that, and that was a pretty common thing, that doctors would actually be the ones building the facilities and running them. And now that's definitely not the case, and we've just sort of been suckered into this position where we're just sort of just cogs in a machine and just turning out for other people. And like you say, the only way out of that is to step out of it, just not be involved in the first place. And you also get to practice better. You actually get to practice real medicine. You actually get to do the things that you see helping your patients, instead of just doing what you're told because that's what the hospital says you need to do. Dr. Sean Baker, he got drummed out of his practice. He was head of orthopedics at his group in, I believe, New Mexico at the time. And because he started coming to these metabolic therapies for people and getting them better so they didn't need joint replacements. And he was really happy with that because his patient was doing better. But it was really pissing off the hospital because they weren't able to bill $70,000, per joint replacement. And they made some trumped up charges and tried to get his license taken away to get him out of there. And it didn't stick. They didn't take his license away. They just investigated him for a couple of years and then said, yeah, there's nothing wrong. And but it's very it's very disenchanting with the whole system, that because you're doing real work for your patients and real benefit for your patients, that your hospital tries to destroy you and destroy your career and your medical license. It's absolutely wild.
But is tau protein the problem, or is it the accumulation of it? It's similar to the heart, the cholesterol hypothesis for the heart. Is the cholesterol the problem, or is it that the cholesterol accumulates in the area of the damage, and that's what we're seeing? And slowly we've migrated